Okay. So when we discuss about the abdominal examination, okay, so what we can find, okay, what we can know from the abdominal examination. So one is lie, okay. Second is, yes, presentation. Is it a cephalic presentation or podalic presentation or breast presentation? Okay. And extra information, yes. Sometimes we can know attitude as well. Okay. When we grab, what is the relative position of occiput and the sinciput? Accordingly, we can have an idea of attitude, fetal attitude. Okay. And if it's engaged, then we can, with the help of fourth maneuver, is it our hand will be diverged, okay, if it's engaged, and if it's not engaged, our hand will be converged. So we can know the information about engagement as well. Okay, so lie, presentation, okay, and engagement and attitude. But what about the denominator? Can we know any information about the denominator? Yes, we cannot know, okay, because this is the part which overlies the internal os. So during PB examination, we know about denominator. Okay, so that is the difference. So that's why we have to do, after abdominal examination, we have to do vaginal examination to ascertain, okay, the denominator. Okay, the main aim is to find out the denominator so that we can know the position of the fetal head, okay, or fetal. If it's a buttock bridge, then we try to identify the denominator, that is fetal sacrum. Okay, in case of fetal face, we try to find out the denominator, that is mentum. Okay. Okay, so the bony fixed point which comes in relation to the maternal pelvis. That's why to know the denominator, we have to do PB examination. Okay, so let's talk about the pelvic. Let's talk about the cephalic. Okay, so this is the most common presentation. Almost 96% of the cases they are cephalic presentation. Okay, that is cephalic presentation and vertex as a presenting part. So in vertex as a presenting part, what is the denominator? Yes, if it's a well flexed attitude, okay, when the attitude is well flexed, then the denominator is occiput. Okay, so now how we can locate the occiput? Because this is very important. Locating the denominator is very important. Okay. Okay, and accordingly, after once you know the denominator, that is occiput, then you can know the relative position of the head. Okay, how we can do? Just when you do the PB examination, you try to sweep. Okay, try to locate the sagittal suture. Your first aim is to locate the sagittal suture. You try to feel the suture. Okay, and once you feel the suture, now you follow. Okay, when you go anteriorly, you can feel a gap in the bone, what we call fontanelle. Posteriorly, when you go, we can feel the gap. Okay, and anterior fontanelle, it is a diamond shaped and it has a gap. Okay, you can feel the four suture line and there is a gap. But what about the posterior fontanelle? It is usually triangular shaped. It is usually triangular shaped, just three sutures you can feel, and it is a bony base. The base will be bony. Okay, at term the base will be bony. Here it is membranous. Okay, so this is the difference. Okay, so first try to locate the sagittal suture, then you follow the suture. Okay, so look here. Okay, so once you find the suture, then once you find the anterior fontanelle, sorry, posterior fontanelle, then you can sweep back and go to locate the posterior fontanelle. Sorry, anterior fontanelle. Okay, so accordingly, once you find the posterior fontanelle, in this case, now look at the. So this is the part just above the fontanelle is, this is the occiput. Okay, and it lies in relation to the maternal pelvis. So this is the denominator. Okay, this is the way we find the denominator. So, and what is the position in this case? Yes, the occiput lies anteriorly. Okay, and it's slightly towards the left side. So it could be left occipito anterior. Okay, or when it's bit central, when it comes in bit central, then it could be direct occipito anterior. Okay, so it is very important. Okay, to know the position. Okay, it has obstetric implication that you will discuss in the labor. Okay, so that's why if it's a transverse, okay, if so try to locate the fontanelle. Okay, so try to feel the sagittal suture first, then you go and okay, when you follow the suture, then you can identify the, yes, fontanelle. Okay, if you find the posterior fontanelle, then you know this is the occiput. If you find the anterior fontanelle, then this is the frontum. Okay, so accordingly we can know the denominator as per the presentation. So is there any other okay, what about auscultation? Does it help? Yes, so it just reinforce finding. Okay, we cannot accurately know the fetal presentation, okay, lie according to the auscultation, but it do help. Okay, it do help. It will help in the reinforcement. Okay, the region of the meta abdomen in which the fetal sounds are most clearly heard. Okay, so it depends upon the presentation. Okay, and as well as descent as well. So look, always for the auscultation, you use the bell of the stethoscope, okay, and you try to calculate the rate. Okay, so look, if now we have to know the position of the fetus. If it's the left occipital anterior position, if this is the umbilicus and this is the anterior superior iliac spine, okay, usually in the midline, okay, anterior superior iliac spine, okay, okay, so this is the umbilicus and this is the anterior superior iliac spine. So it's try to locate. So usually spino-umbilical line, okay, around the midpoint of the spino-umbilical line, it lies left. If the position is left occipital anterior or left mid to anterior, if it's a face presentation, also you'll locate the fetal heart sound over this midpoint between umbilicus and the anterior superior iliac spine. Okay, if it's a right, then in the same position, in case of right, okay, right occipital anterior or right mid to anterior. In case of posterior position, okay, left occipital posterior or right occipital posterior, beyond that line. Okay, in case of bridge presentation, okay, if the buttock has a presenting part, then sacrum is a denominator. So right sacroanterior and left sacroanterior, so it's above the umbilicus. Okay, and sacroposterior more posterior. Okay, so just rule of thumb, if it's a cephalic, then it will be below the umbilicus, and especially in the midpoint of the spine umbilical line, you can find the fetal heart sound. Okay, you can appreciate the fetal heart sound on the spino-umbilical line, midpoint of the spino-umbilical line. If it's a left occipital anterior, then you try to look at the left part of the maternal abdomen. Okay, and in case of right part of the maternal abdomen over the midpoint of anterior superior iliac spine and umbilicus. Okay, so that's why the auscultation, it varies from the location and position as well, position of the fetal head. Okay, so that's why you can use this to correlate your finding. What about the other methods to know the presentation and lie? Okay, so sometimes maternal obesity, X-liker, the location of the placenta, they hinder us to know the exact lie presentation. Okay, so in such case we can take a help of ultrasound. Okay, so ultrasound can help in identification of fetal lie, position, okay, even attitude you can see. Okay, so it is widely used. Okay, commonly we use every time at third trimester we send ultrasound to locate to ascertain the lie presentation, okay, as well as position, and it is safe in pregnancy. What about other radiological methods like fetal MRI we can do, but rarely we go for lie presentation and attitude because it is very expensive. Okay, it's very expensive, that's why we do not commonly do fetal MRI. X-ray, it's traditional, not done these days. Okay, so any queries? So this is more practical part of the lecture. Okay, so if again you will when we try to demonstrate these findings, this obstetric maneuver, then it will be more clear. Okay, but make sure that you should know the theoretical part. Okay, so what is lie, what is presentation, what is presenting part, okay, what is the denominator, what is the position, what is the attitude. Okay, this term you should be familiar, okay, before we discuss about the clinical examination. Okay, so any queries you can write in the chat box or you can just unmute and ask. Okay, thank you everyone.